I started PT originally because my joints were so lax that I dislocated my shoulder holding brain. And once I started doing PT, I also realized that it was also apparent that I had tightness where my C-section was and where my daughter was carrying. She was carrying super high, so she pushed my diaphragm up and made it very difficult for me to breathe. So coming to PT, I was able to work on my scarring as well as my laxicity and my whole movement of my diaphragm. Now I can breathe. I'm a severe asthmatic and I suffer from fibromyalgia. During pregnancy, I went to almost no medication and it was terribly painful. My daughter was a little bit of a violent baby inside my stomach as well as huge. So when I had a giant baby and everything just kept getting bigger and bigger, the pain got worse and worse. And she kept moving higher and higher, which pushed my diaphragm, and like all pregnant women have difficulty breathing with the asthma and other issues with my lungs. I already had discomfort, and so she made it very, very tricky for breathing purposes. And then when she came out, I still didn't have everything go back to where it was supposed to be. And I'm still working on figuring out the better protocol for the fibromyalgia right now. But with PT and chiropractic and all my other things that I do, I am really working towards trying to get back to where I was before pregnancy. Between all of our friends, pelvic floors are still, even if you have a C-section, you still have some pelvic floor stuff that you need to work out. No one that has babies really gets out of that, even if you get yours, like mine was taken via C-section. Everyone has, you have a tiny baby, you have a giant baby, you're gonna have some sort of pelvic floor thing because they've been laying in your pelvic floor like a hammock for 9 months, and they've been stretching it out and beating it and like abusing it. And obviously after 9 months, nothing is going to be as taut or as perfect as it once was. So everyone needs to do some pelvic floor work post-pregnancy. So some people tell me that they feel like there's just like no end, that they feel like they're gonna fall out their body. And I don't have that sensation, but I do still have numbness in certain places, and I still have discomfort sometimes, and it's depending on certain angles of sitting, I'll feel a little bit of pulling, but it's no one gets out of it. Everyone's got something. Some people dribble. That's more common. Yes, people have dribble. Everybody's got some dribble. Right. In close groups of girlfriends, I will tell you that there's a group of us, and there's definitely jokes about how we all have at some point dribbled plenty. Goodness, I don't know how far out postpartum I was, but I was changing my daughter, and I held her up for a quick second for my husband to help me shove a outfit underneath her. And just as he pulled his arm back and I went to put her back, she started pooing everywhere, like everywhere. And she was still small, so the poo was still very liquidy at the time, and it was going everywhere. And we were hysterical, and I definitely peed myself that day. We were laughing so hard. My husband fell over. We were just hysterical. And I didn't fall over because I'm holding the baby full of poo, and you can't put her down to fall over. So I stood there holding a baby covered in poo.
That's amazing.
It's never too late to go to physical therapy. It's if you find a physical therapist that you're not sure about, then look for another one. And make sure that you find a physical therapist. The best place to find one is call a friend. And if you don't have a friend who's got one, you can post them in mommy groups wherever you live. There's always a Facebook group or an Instagram group for mommies in your area. And there's going to be 30 different options in 12 seconds. You'll just get shoop, bloop, bloop. And anytime anyone asks in our groups, I always tell them to go to anesthesia.